Newborn screening is just one of the strategies that can reduce infant mortality. In the Philippines, the Department of Health introduced Essential Intrapartum and Newborn Care, or EINC, as a strategy of ensuring higher survival rates of newborns and even improve maternal health and lessen risk of maternal deaths. It is also referred to as Unang Yakap or First Embrace. In one of the pilot hospitals, skin-to-skin contact was associated with lower mortality, sepsis, and severe disease. Non-separation of mother and newborn led to successful initiation of breastfeeding and manifested in high exclusive breastfeeding rates. 90 to 100% upon discharge, 85% at day 7, and 69% at day 28. Another strategy to decrease infant mortality is to prevent them from acquiring communicable diseases, especially those which are vaccine preventable. As a result, the Department of Health established the Expanded Program of Immunization, or EPI, to ensure that infants or children and mothers have access to routinely recommended infant or childhood vaccines. So there are 6 vaccine-preventable diseases that were initially included in that EPI. The first one is tuberculosis, followed by poliomyelitis, diphtheria, tetanus, pertussis, and lastly, measles. Later on, the hepatitis B was also included. So let's talk about hepatitis B. What is hepatitis B? It is a potentially life-threatening liver infection caused by the hepatitis B virus. It is a major global health problem, and it can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. Additionally, a vaccine against hepatitis B has been available since 1982, and its effectivity rate is at 95%. So the hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the hepatitis B virus, on the other hand, is 75 days on average, but can vary from 30 to 180 days. The hepatitis B virus can be spread in the following ways. The first one, in highly endemic areas. Hepatitis B is most commonly spread from mother to child at birth, or perinatal transmission, or through exposure to infected blood, or horizontal transmission. The next one is through percutaneous or mucosal exposure to infected blood and various body fluids, as well as through saliva, menstrual, vaginal, and seminal fluids. Next is sexual transmission of hepatitis B may also occur, particularly in unvaccinated men who have sex with men and heterosexual persons with multiple sex partners or contact with sex workers. Next is reuse of needles and syringes either in healthcare settings or among persons who inject drugs. And lastly, transmission of the virus may also occur during medical, surgical, and dental procedures, tattooing, or through the use of razors and similar objects that are contaminated with infected blood. Recently, rotavirus and pneumococcal vaccines are being considered. Below is a table that will serve as your guide that describes how each antigen is given.
There are very few contraindication and precaution conditions. Only 2 of these conditions are generally considered to be permanent. It is the severe or anaphylactic allergic reaction to a vaccine component or following a prior dose of a vaccine and the encephalopathy not due to another identifiable cause occurring within 7 days of pertussis vaccination. To ensure the optimal potency of vaccines, a careful attention is needed in handling practices at the country level. This includes storage and transport of vaccines, from the primary vaccine store down to the end user at the health facility and further down at the outreach sites. A first expiry and first out or FEFO vaccine system is practiced to assure that all vaccines are utilized before its expiry date. Proper arrangement of vaccines and or labeling of expiry dates are done to identify those close to expiring. Vaccine temperature is monitored twice a day, early in the morning and in the afternoon, in all health facilities and plotted to monitor break in the cold chain. Each level of health facilities has cold chain equipment for use in the storage of vaccines, which include cold room, freezer, refrigerator, transport box, vaccine carriers, thermometers, cold chain monitors, ice packs, temperature monitoring chart, and safety collector box. There we have the diagram and about handling vaccines. First is the manufacturer, followed by the vaccines, the international transport or the transportation with refrigerated trucks and cold boxes, or the vaccine carriers for outreach, followed by the national airport that requires transit storage facilities about 2 degrees to 8 degrees Celsius, followed by the primary vaccine store requires cold room about 2 degrees to 8 degrees Celsius and freezer room to negative 15 degrees Celsius to negative 25 degrees Celsius, followed by the intermediate vaccine store that requires cold room about 2 to 8 degrees Celsius and a freezer room about negative 15 to 25 degrees Celsius, followed by the intermediate vaccine store that requires refrigerators about 2 to 8 degrees Celsius and freezer room that requires negative 15 to negative 25 degrees Celsius, followed by the health center that requires refrigerators that is 2 to 8 degrees Celsius and cold boxes, followed by the health post that requires refrigerators 2 to 8 degrees Celsius and cold boxes or vaccine carriers, and lastly is the child to mother. Cold chain refers to the process used to maintain optimal conditions during the transport, storage, and handling of vaccines, starting at the manufacturer and ending with the administration of the vaccine to the client. The optimum temperature for refrigerated vaccine is between 2 degrees Celsius and 8 degrees Celsius. For frozen vaccines, the optimum temperature is negative 15 degrees Celsius or lower. And in addition, protection from light is a necessary condition for some vaccines. And vaccines are sensitive biological products which may become less effective or even destroyed when exposed to temperatures outside the recommended range. Cold-sensitive vaccines experience an immediate loss of potency following freezing. Vaccines exposed to temperatures above the recommended temperature range experience some loss of potency with each episode of exposure. Repetitive exposure to heat episodes results in cumulative loss of potency that is not reversible. However, information on vaccine degradation is sparse and multi-point stability studies on vaccine are difficult to perform, and information from manufacturers is not always available, so it can be difficult to assess the potency of a mishandled vaccine. And there are 3 main elements necessary to ensure proper vaccine transport, storage, and handling. It is the trained personnel, transport and storage equipment, and efficient management procedures. Proper vaccine storage and handling practices play a very important role in protecting individuals and communities from vaccine-preventable diseases. Vaccine quality is the shared responsibility of everyone, from the time vaccine is manufactured until it is administered.
Chapter 8: Emerging Trends in Public Health. Health is dynamic, constantly evolving and changing over time. The challenges in healthcare, particularly in public health, are as emerging as they are complex. Over time, trends in mortality and morbidity patterns within countries and around the world have been changing. The challenge is to develop health systems that are resilient and at the same time evolvable, quick enough to respond to ever-changing landscape of death. According to Castillo Salgado in 2010, with the transition from 20th century into 21st century, international travel, trade, commerce, as core dimension of globalization have become key factors or forces in reshaping public health at the national and international levels. Summarized report of thematic roundtable session of the Economic and Social Council of the United Nations in 2009. Among the themes that are discussed is demographics. Both historical and contemporary factors are responsible for aging populations in low-income countries. There is a rapid aging in developing countries due to a decline in mortality, a decline in current fertility, but also a decline as in child mortality. 66% of population growth of those over 65 is due to a fall in past childhood mortality. Increased dependency ratio places is additional pressure on healthcare and pension systems. Participants emphasize the need to anticipate these demographic challenges, giving particular attention to the frailty of the over 65 group in low-income countries, who have higher life expectancy but a lower healthy life expectancy due to a poor health in early childhood. Given the evidence that child health is primary determinant of the future income, a renewed emphasis must be placed on child health as a factor in economic growth. Panelists also focus on the rise of non-communicable disease, the continued impact of communicable disease, and the rise in diseases attributable to climate change. Increasingly, non-communicable diseases pose a significant challenge to public health authorities in light of increases in tobacco, alcohol, and harmful substance abuse. An increased focus must be put on anticipation and prevention. Particular attention must be placed on preventing non-communicable disease given the increased prevalence of chronic diseases in developing countries. Prevention and treatment of non-communicable diseases and communicable diseases requires the establishment and maintenance of the new innovative mechanisms and an emphasis on the primary health care approach. According to CDC, the Ebola is the largest epidemic in history, affecting multiple countries in West Africa. In his speech, during World Health Organization Ministerial Meeting in Singapore in February 2015, Minister Lee Hsien Loong remarked that the current outbreak in Africa and our experience with SARS a decade ago reminds us how disruptive and terrifying public health crises and epidemics can be. But even short of an epidemic and a crisis, if some parts of the society are sick or prone to disease, it affects everybody. World Health Organization Director General Margaret Chan mentioned in her report that Ebola is a tragedy that has taught the world, including World of Health May lessons, also how to prevent similar events in the future. She went to say the Ebola outbreak points to the need for urgent change in three main areas are to rebuild and strengthen national and international emergency preparedness and response, to address the way new medical products are brought to the market, to strengthen the World Health Organization operates during emergencies.
Dr. Chan said that well-functioning health system that can withstand shocks, whether these are caused by a changing climate, a runaway virus, or an overload of patients with non-communicable diseases. Climate change has huge impact on health of populations, especially in areas of disaster. Learning from Ebola crisis, Crook et al. 2015 wrote that responding to a crisis needs both vigorous public health response, highly proactive and functioning healthcare delivery system. Crook et al. Went on to further describe the characteristics of a resilient health system. Number 1. Resilient health systems are aware. Resilient health systems have an up-to-date map of human, physical, and information assets that highlight areas of strength and vulnerability. Resilient health systems should be diverse. Health systems that have the capacity to address a broad range of health challenges rather than a targeted few are more stable and capable of detecting disturbances when they arise. Number 3. Resilient health systems are self-regulating. They have the ability to contain and isolate health threats while delivering core health services and avoiding propagating instability throughout the system. Number 4. Resilient health systems should be integrated. Resilient health systems bring together diverse actors, ideas, and groups to formulate solutions and initiate action. Sharing of information, clear communication, and coordination of multiple actors are hallmarks of integration and are best achieved by having a designated focal point in the health system. Number 5. Resilient health systems are adaptive. Adaptability is the ability to transform in ways that improve function in the face of highly adverse conditions. Any adaptations should enhance performances in the short term and ideally contribute to building long-term resilience. Adaptability does not manifest only in crisis. Resilient health systems demonstrate the capacity to adapt in normal times, such as to changing epidemiological and demographic needs of people. Changes in public health will also require new ways of understanding the field of public health. Public health epidemiology will come to develop particular approaches and methods to satisfy demand for a better understanding of population-based measure of risk. As the world ventures into the 21st century, it is getting clearer that what we know of public health or health in general is only but the tip of the iceberg. Emerging trends in the global community provides the opportunity for both innovators, and trailblazers. The world is changing and the way one thinks and does must keep pace, especially in public health.